Urinary tract infections are most commonly bacterial infections of the urinary tract. When I say commonly, it's because we can see some fungal infections causing urinary tract infection. For the most part, they are bacterial in nature. What is commonly affected in a urinary tract infection is the bladder. Note this as cystitis. There are other parts of the urinary tract that can be affected, like the ureters. They can get so bad that they ascend up the kidneys, causing pyelonephritis. We are going to talk about the complications in this video as well, so don't forget to share this video. Your skincare will work better if you do. Before we get into the signs and symptoms of urinary tract infection, it is important to know that some organisms may colonize the urinary tract, but cause no symptoms. As I said earlier, an ascending UTI can infect the kidneys, causing pyelonephritis. Now, the epidemiology of urinary tract infection is as follows. Females outnumber males. This is because females have a shorter urethra than males. The bacteria has shorter distance to get to the bladder. This is at a 4:1 ratio. UTI are so common that it is estimated that 40 to 60% of women will develop a UTI at some point in their life. They occur most often in women aged 16 to 35 years of age. What are the actual signs and symptoms of a urinary tract infection? The first of them is dysuria. This is a sensation of pain when urinating. As an individual is urinating, they have burning sensation. This is because there is irritation of the bladder and lower segments of urinary tract, caused by infective microorganisms. So there is inflammation. And this burning sensation. The second, but not as bad as the third, is urgency. This is the feeling of wanting to urinate urgently. You feel like you have to quickly go to the bathroom to urinate. And this is due to bladder irritation. Some other symptoms include urinary frequency, urinating more frequently than normal. This is also due to bladder irritation. This also happens when the bladder is empty. Dysuria, urgency and frequency are the major symptoms of a urinary tract infection. Some other symptoms include foul-smelling urine. Urine may smell more foul than usual due to pyuria and bacteriaria. Just the presence of bacteria in the urine can change the smell of the urine. Another symptom of UTI that may occur is suprapubic pain. This is pain in the pubic area due to irritation of the bladder. Another sign of a UTI is hematuria, which means presence of blood in urine. Presence of bacteria can cause irritation and trauma in the urinary tract, even at a microscopic level, causing bleeding to occur. This hematuria is often microscopic hematuria, meaning we don't see it with the naked eyes. We can only see it on a urinalysis dipstick. This is due to organ irritation. Some other symptoms of UTI include urinary hesitation. Urinary hesitation is the difficulty initiating urination or maintaining urine stream. You may also notice post-void dribbling. This is when there is residual urine after voiding. The next signs and symptoms we're going to talk about are caused by pyelonephritis. This is when the UTI has ascended to the kidneys. This can be a complication of a UTI. In pyelonephritis, there are symptoms like flank pain. Flank pain is when there is pain in the lower side of the back where the kidneys are located, at the bottom of the rib cage. If the area is palpated, the person feels pain. This is called costovertebral angle CVA tenderness. That is a very critical sign of pyelonephritis. Because of this infection of the kidneys, they can be fever and chills. Along with flank pain, this is the most common sign and symptom. If the body is infected, the immune response can cause a fever. Another symptom is nausea and vomiting because the person is very ill. Do you have any of these symptoms? Let us know in the comments. Hit the like button, share and subscribe for your skincare to work better. As usual, I'll see you in my next video.